everyone, and welcome back to another video. And today is just going to be kind of a more talking type of vlog because I wanted to show you what a typical weekend looks like on my emergency and critical care shift on a home game weekend. So for those of you who don't know what Virginia Tech's parking lot is like for their football games, they take over the entire veterinary medicine parking lot and use that for tailgating and use it for parking their campers. And it's just kind of difficult for the clients coming in for emergency services along with the workers who work the weekends. And I kind of wish I could go to one of the home games, but unfortunately it's not looking like I'm going to be able to because I am working every single weekend for the next couple weeks. But I'm definitely rooting for the Hokies today, and I do hope they win their football game tonight. Quite exhausted, honestly. I was working last night until 1 in the morning, and then I am back now for my 2 p.m. to 11 p.m. shift. I really hope I don't stay that late tonight, but I might. It just depends on if I want to stay to see something interesting or they need help. My cases yesterday were crazy. I got to diagnose a cat with FIP, then we got to do pleural effusion, so I got to see how a chest tube is placed. I got to see live maggots yesterday, which I'm not a huge fan of, but that was quite interesting how that all happened. But I'm not gonna lie, I'm starting to feel pretty burned out. Even though I just came back from vacation, it is such long hours. My body doesn't adjust well to switching times, so it's been kind of difficult. And I have not really been able to study for the NAVLE as much as I've wanted to, just because of how crazy my work schedule is. And then my next rotation is another round of emergency services, but that time it's going to be for large animal medicine instead of small animal. It's just a lot. We're making it through, and I'm looking forward to seeing what type of patients we see tonight. I feel like I'm getting slightly better with learning how to triage patients and kind of seeing things I've never really seen before. Like last night we even got a snake bite, and I wasn't sure how we did anti-venom, if there was specific anti-venoms for specific snakes. And apparently it's just one anti-venom that we have that's pretty universal. I'll probably update you guys later tonight or tomorrow morning before I head in for my next shift. It just depends on how exhausted I'm going to be and what the lighting is like. But I know I'm probably leaving around the same time as the football game ends. So that's going to be interesting. I'm expecting a lot of parties tonight, so I'm definitely going to wear my earplugs and wear my eye mask when I get home tonight to sleep. I think that's enough of me stalling. I should definitely go inside and get ready for work, and I will chat with you later. So it is the next day. I'm actually outside waiting to start my next shift. Last night was pretty busy. I came in and dealt with a kitten who had panleukopenia, which is basically the feline parvovirus. So I got to learn how to go into the isolation area yesterday because we do not want that exposing the rest of our patients in the actual main hospital. So we have a special designated area for patients who are highly infectious to others. And then after that, I was in charge of another patient that managed to get a hole at the back of its throat from playing with a stick with their owners earlier in the day. So we had to suture that closed. And then I was dealing with another patient that got attacked by a dog. So we had to clip and clean the wounds and then make sure that there wasn't any significant damage. So that took quite some time. And then I had another patient that was suspected DKA, which is diabetes mellitus ketoacidosis. It was kind of a late night. I didn't leave again until 1 o'clock in the morning, so it was a long night. Again, I'm hoping tonight's a little bit better. It should be, just because I have help today. But unfortunately, the Virginia Tech Hokies didn't win the game last night, so when I left, there was really no parties going on. No one was walking around, really. Maybe next time we can win our home game, but I don't believe that game's going to happen until like a week or two from now. It's already been a very busy morning on the schedule for ER, so I'm interested to see what patients I'm going to end up getting today. This has been such a difficult rotation, but it's been so eye-opening as to everything that ER deals with. I do appreciate this opportunity. I wasn't feeling the best this morning, so I already took some medication just to prevent myself from getting sick, because in vet school you really cannot get sick during your 4th year of vet school because you are constantly in the middle of rotations. It's very difficult to take time off. Just trying to prevent myself from needing to take a personal day or a sick day, especially on rotations like these where you may be the only student working, and it really does hurt the people that are working, unfortunately, if you're not there, because we actually do quite a bit. It definitely is difficult because at the same time you want to work on your well-being, but unfortunately this field really isn't like that, where you can take the time off that you need. They do their absolute best. It's difficult and challenging, especially for people in ER. Take time off. I'm going to go ahead and head in and start my day. Wish me the best of luck, and I most likely will see you tomorrow. If tonight turns out anything like it did last night, I'm probably going to be exhausted when I go home. I will talk to you guys later. As you can see, it is officially the next day, and since I am in scrubs, I am on the way to work again shortly. Last night went pretty well. I only had 3 patients, but I was still kind of there until 12:30 last night, just because my case went longer than anticipated, which tends to happen in ER, and I feel terrible leaving it to someone else if I can go ahead and get through the appointment already, so I just usually end up staying. I did have a very fractious cat yesterday that we really couldn't touch that ingested laundry detergent, potentially. So we had to evaluate the cat to make sure that there was no ulcerations in the mouth, because sometimes it can cause some issues. But we worked very closely with the pet poison helpline yesterday with that case, because there are so many toxins out there that it's really hard for the veterinarians to know it all. So we do have special veterinary toxicologists that we speak with and communicate with, to help figure out a treatment plan and best options for supportive care if necessary. I did have 2 other appointments. One was a potential fracture. The patient was non-weight bearing on a leg, so we ended up doing radiographs and checking to see what our options are, because the patient is very young, so we are concerned about the growth plate being affected. So I believe I'm still working that case today, because they are coming back in for an orthopedic consult to see what the next best steps are, because it did look like it involved the growth plate a little bit. So the best chance that we can give this patient to not have a shortened limb later on in life or arthritis early on, we always consult with our orthopedic surgeons just to determine the best course of action. And then I did have a patient with bloody diarrhea, and We are doing a lot of supportive care because this is the second time that this patient has come in within the past week for the same issue, and it just seems to keep worsening, so hopefully with the medications we did last night, we can get the diarrhea under control. So these are just some of the type of cases I've seen this weekend. If you did like this video, please be sure to give it a like and subscribe for more, and I will see you all next time.